is Troy Grennan, and I'm an assistant professor at McMaster University and a clinician at the Maple Leaf Medical Clinic in Toronto, as well as the HIV clinic in Hamilton. The study I'm conducting through the CTN is essentially meant to look at the diagnostic accuracy of a new mRNA-based human papillomavirus assay, which will be performed for anal canal infection in HIV-positive men. The study has two parts. The first part is essentially looking at historical samples in the population of patients that have been followed at the anal dysplasia clinic at the Toronto General Hospital in Toronto. And using these samples, we will compare this new assay, this mRNA-based assay, and compare the results of this assay to the conventionally used DNA-based assay. The second part of the study, which is examining the performance characteristics of this test when administered by a clinician and when administered by a participant, is important as well, because again, recognizing the limited resources and personnel we have to both diagnose and screen these individuals who have HPV-related anal disease, it would be really helpful if we could actually figure out ways that are feasible, cost-effective, and which work and which are effective in helping ease the burden on the already stretched healthcare system in managing these people. And if individuals were able to do their own testing, at least their own initial swabs, with a test that's, let's say, quote-unquote, better than the currently available test, that would really help prioritize people in terms of deciding when they should go for screening, diagnosis, or further investigations. So there are a number of reasons why this study is important, and there are a number of reasons why it will provide some new information for the diagnosis and treatment of HPV-associated disease in HIV-positive men. First of all, we know that the prevalence of high-risk or oncogenic cancer-causing HPV in the anal canal of HIV-positive men is quite high. So if you were to test 100 people for anal canal HPV, specifically HPV that is potentially cancer-causing, you would find it in up to 80 to 90, some studies would say even 80 to 90% of individuals would have evidence of high risk or oncogenic HPV in the anal canal. Certainly we know also that most of these infections are typically transient, so they won't persist, and people will eventually clear them. So realistically, a one-time isolation of one of these oncogenic strains of HPV is really not necessarily concerning. However, the conventional test, as I mentioned earlier, the DNA-based test which is used, will pick up essentially all of the infections and doesn't give us any idea as to whether or not the infections will persist, whether they are active. They really just tell us whether it's there. This new mRNA-based assay, and this particular assay has never been tested to our knowledge, has never been tested in men or in the anal canal. So the reason this assay is important is because it's felt to target a part of the virus that is felt to be more relevant in these persistent cancer-causing infections. And I guess the bigger picture here, the reason why all of this is important is because we know that HPV is the leading cause of not only cervical cancer in women, but it's also the leading cause of anal cancer in general. Up to 80 to 90% of cases of anal cancer are caused by HPV. We also know that certain populations, so specifically HIV-positive men who have sex with men, are at greater than 100-fold risk when compared to the general population for developing anal cancer related to HPV. Certainly it's a very young field, and though we have a lot of information on epidemiology and prevalence numbers, risk factors, a lot of these sort of descriptive things, the field of diagnosis, screening, and treatment for these individuals is still very young, still very under-investigated, and still requires a lot of data before we're able to make any definite conclusions about what the best approach is in diagnosing, screening, and treating these individuals.